Welcome, everyone. Thank you for joining us. Welcome to part 2 of the Perfect Storm of Extraction, Poverty, and Climate Change webinar series. Today's webinar is the effects of health and housing quality on climate vulnerability and resilience. My name is Taylor Ward, she, her, and I am the Communications and Education Programs Manager at Just Solutions. So Just Solutions is a BIPOC-led national climate organization that partners with communities disproportionately impacted by climate change to turn their priorities and ideas into policies and laws. We are broadening and deepening the understanding of equitable and effective climate policies and projects, and we're fostering a national community of peer learning for Black, Latinx, Asian, Indigenous, and frontline community-based organizations to elevate their solutions and replicate them across the country. Thank you all for joining us today. You can feel free to add your name, your organization, and where you're located in the chat so everyone can know who else is on the call. We are also live tweeting this event, so if you want to follow along on Twitter, our @name is @just_solutions_, or you can use the hashtag health, housing, and EJ to share your thoughts. So today's webinar will improve our understanding of the real-world health and infrastructure conditions that constrain the capacity of frontline communities to cope with, prepare for, and respond to climate change. We will also introduce a framework that is grounded in key indicators to help us measure the adaptive capacity of resilience of frontline communities and the positive or negative effects of public policies. So here is our agenda today. This includes an introduction of today's speakers, a presentation of the findings from the Perfect Storm report, and presentations from our 2 guest panelists. We will also end with a Q&A discussion, so if you have questions throughout today's event, you can use the Q&A box to drop those questions. So to get started with these introductions, first up are the authors of the Perfect Storm report. This includes Zuly Juarez, the Senior Research and Policy Analyst at Just Solutions. At Just Solutions, Zuly works to identify, research, and analyze existing environmental policies, practices, procedures, and laws. The co-authors, Jennifer Moon, a research consultant with Moonlight Solutions. Jennifer has over 20 years of experience in social services and public health, serving as a researcher, analyst, and communicator. Our first featured partner organization is the Joint Center for Housing Studies of Harvard University. The center produces a wide range of working papers, research briefs, and major reports about home ownership, rental housing, affordability, aging, remodeling, and more. The annual State of the Nation's Housing Report has been the definitive source of information about U.S. housing markets for over 30 years. Our guest panelist from the center is Carlos Martin, Project Director of the Remodeling Futures Program. Dr. Martin's research on green housing, disaster mitigation and recovery, substandard housing, construction innovation, and the construction workforce connects the brick and mortar of existing housing to its social outcomes. He formerly served as a senior fellow at the Urban Institute and is currently a David N. Rubinstein Fellow at the Brookings Institution Metropolitan Policy Program. Our second featured partner organization is the Center for American Progress, an independent, nonpartisan policy institute dedicated to improving the lives of all Americans through bold, progressive ideas, as well as strong leadership and concerted action. The public health team at CAP advocates and supports efforts to promote cleaner air and water, better sanitation, food safety, safer environments with less violence and injury, disease prevention, and access to vaccines, among other priorities. Our guest panelist, Jill Rosenthal, is the Director of Public Health Policy at the Center for American Progress, where she works with other experts at CAP to develop and advance bold solutions to address structural public health issues and tackle health disparities through a social determinants of health framework. Before joining CAP, she served from 2000 to 2021 as a Senior Program Director at the National Academy for State Health Policy. And with that, I will hand it over to Zuly Juarez, co-author of the Perfect Storm report, to share with us findings of the report.
Thanks, Taylor. We're super excited to share the findings of our report today, and you can view the full report on the bit.ly address shown on the slide. Just to get started with some context, as we know, BIPOC and frontline communities bear the disproportionate burden of environmental and climate impacts. And through a variety of studies and mapping efforts, we can identify how those communities at greater risk and the many factors that put them at risk, but we are less successful at communicating the causal relationship or how these conditions came to be or are perpetuated through policymaking. So in our report, we used the case study approach to examine what we called a pre-existing condition in 6 frontline communities. And these conditions affect the capacity of residents to cope with, prepare for, and respond to climate change. We looked at 3 domains, and that's economic, health, and infrastructure conditions. And our goal was to communicate what the real world conditions across these communities are and to develop a framework for examining the adaptive capacity and resilience as these communities and others like them across the country confront climate change. Our first webinar of our series took place in July, and it focused on economic conditions, and today we'll focus on health and infrastructure conditions. And in our third webinar, we will discuss community-created solutions, and you can access our first webinar at the bit.ly address also shown in the slide. Next slide, please. First, we want to go over a few definitions. We wanted to highlight not only risk factors relating to climate disasters, but also the ability to cope with the current challenges associated with climate change. So in regard to health and infrastructure, that means improving health conditions and health support so that residents are better prepared to cope with heat waves, for example, and to improve urban planning and ensuring that residents can escape or mitigate heat by having the benefit of tree canopies or other features that provide relief on an everyday basis. Next slide. So a little bit about the communities that were profiled. They were selected for their geographic diversity. They are a mix of rural and urban areas spread across the country. Most of them are counties, but the east end of Bridgeport, Connecticut, and East Las Vegas, Nevada are zip codes in urban areas. And as a counterpoint, we also looked at Marin County, which is located just north of San Francisco and is one of the wealthiest counties in the country. And the profile communities share several characteristics in common. They are very low income with high levels of poverty. In each of these communities, 25% or more of their population lived in poverty in 2020, as defined by the federal poverty guidelines. So the conditions in these communities are amongst the most challenging in the country. And they were selected based on the premise that improved outcomes in these communities will reflect positive policy change benefiting frontline communities generally. They also have majority BIPOC population, with an exception of McDowell County in West Virginia. McDowell County, however, is one of the most diverse counties in West Virginia. It has one of the state's few Black majority towns. And then they all have significant histories of resource extraction, labor exploitation, or financial speculation. So as described in the paper, their current conditions are the result of past policies and exploitive practices that have left these communities behind. And despite these histories, these communities have demonstrated resilience and innovation, again, despite continued trends of neglect and oppression. Next slide. We conducted interviews with representatives of each of these communities profiled, and their voices are highlighted throughout the report. In some cases, residents spoke about the assets, challenges, and innovative practices in their communities. In others, those who work closely in the profile community share their understanding of local conditions. Those interviewed present basically compelling evidence of the real life conditions, community strength, and resilience, and what will be needed to improve community outcomes. Next slide. These communities face significant challenges related to health and infrastructure. The two are interconnected. Support infrastructure, such as unstable electric grid or outdated sewage and water systems, can endanger health. These communities have all experienced exploitation of labor or resources, followed by various forms of divestment. In several cases, investments were made in order to extract economic gains. And when resources were expended, the communities and their residents fell into decline. The industrial waste left behind from histories of exploitation and resource extraction now poses daily health risks to residents and even greater risks in the event of floods in particular. So several of the communities we looked at regularly experience urban inferno conditions because of the lack of tree canopies or other places to seek shelter during extreme weather. Next slide. So these are indicators we examine in the paper related to health conditions. Health access affects both current health outcomes and ability of residents to recover from climate disasters. Poor health puts people at higher risk from extreme heat and complicates the treatment of many chronic conditions. In the report specifically, we focus on chronic conditions such as diabetes, kidney disease, that are reliant upon a steady power supply for their treatment. So certain medication used in the treatment of these conditions also require refrigeration. If residents lose power, it can be life-threatening. So preterm birth rates, which tend to be higher in these communities, are associated with higher rates of asthma. Asthma can then be affected by poor air quality that comes with extreme heat or increasing wildlife risk. Next slide. These are the infrastructure conditions we looked at. The quality of the housing stock in many of these communities is poor, and conditions have grown worse as a result of flooding or other effects of climate change. When residents lack economic resource to make needed repairs, the housing quality deteriorates further, with both economic and health consequences, right? So in Black majority community of Keystone in McDowell County, West Virginia, for example, they were under a boil water notice for 10 years because of abandoned infrastructure left behind by mining companies. And in Hidalgo County, Texas, industrial waste now presents significant health hazards and jeopardizes safety in climate disaster, if a climate disaster were to strike, right? And then East Las Vegas, the urban inferno effects are the result of a combination of poor air quality and a lack of tree canopy. Next slide. To give you all just like a sense, really a snapshot of some of the data we reported in the paper, we wanted to share two charts with you highlighting some of the health conditions community members live with and infrastructure conditions in the communities. So residents have high rates of chronic conditions. The health conditions shown here all involve treatments that can be dependent upon a reliable source of electricity. So residents are particularly exposed to health risk in the event of blackouts or utility shutoffs. And one thing to note here is that the data for Bridgeport, Connecticut, and East Las Vegas are reported at the county level, so these figures likely overstate health outcomes in those communities. Next slide. And on this slide, you get a sense of housing conditions. Most of these communities have vacant housing unit rates that exceed the national average. The rate of vacant units provide a glimpse at housing quality, economic vitality, and just the general state of community life. Next slide. So those who were interviewed validated the conditions that we saw in the data. They spoke to the challenges in accessing healthcare in everyday life, which became even more difficult in the event of an economic, public health, or climate disaster. They also pointed out to the difficulties of updating stormwater or other types of infrastructure to protect the health and welfare of residents, as well as the disadvantages residents face in being able to escape from or mitigate the effects of extreme weather. And many also spoke about life during the pandemic and post-pandemic, right? And just how that has impacted them as well. Next slide. So looking at all the indicators we examined together, we see the real challenges these communities face. Health impacts are significant for residents who are already living with higher rates of chronic condition and other health challenges, and they are likely to become greater as a result of climate disasters, as well as worsening economic stressors. Their infrastructure leaves them at a disadvantage in responding to climate change generally and to climate disasters in particular. Or in taking steps to adapt to climate change, such as through home weatherization. They face increased risk of death or illness from blackouts and shutouts, as we mentioned, exposure to environmental toxins, flood, and exposure to extreme heat or cold. And they are less likely to benefit from things like weatherization or even FEMA relief. Next slide. So there are policies that we could adopt to address these challenges. These are just a few of the policies that we identify in the paper that could improve health and infrastructure conditions in these communities. These include addressing the social and environmental determinants of health, things like having stable housing, economic and education opportunities, and clean air and water. We can also prioritize these communities for upgrades to their stormwater, water and energy delivery systems. Many homes are in such poor condition that they don't qualify for weatherization assistance. So funding home repair to bring these homes up to a standard where they can be more energy efficient would improve housing stability and overall climate change readiness. And we need to ensure that these communities are able to mitigate the increased effects of extreme heat. Next slide. So takeaways. Public policy has made these communities what they are. Future policy making will similarly determine whether or not we achieve climate justice and a just transition or not. We would argue that measuring indicators like the ones presented here will help us to determine whether policy making is effective or not. But that wraps up the presentation for the report. And now I'll pass it on to Carlos to share his work at the Joint Center for Housing Studies at the Harvard University.
Thanks, Uli, and thank you, Just Solutions, for inviting me to comment on this paper, as well as talk a little bit more about sort of the broader scope of work that's occurring right now. So let me start by, I know we have a Q&A period, so I want to make sure there's plenty of time with that. So I'm only going to make 3 overarching comments about the report. And building off of that report, 6 case studies to think about what the national story is that we're telling here, as well as where this study can go next. First comment is that I really appreciate the place-based nature of the report. In my work, I always argue that place-based exposures and vulnerabilities need to be unpacked locally. That the story always varies at the local level. So we certainly know that environmental exposures, and I'm distinguishing exposures from vulnerabilities, that environmental exposures and climate-related exposures will vary greatly. Compare like Miami-Dade, Miami Beach, high-priced beachfront communities exposures, which are high exposed communities, but are very different circumstances than Homestead, Miami-Dade, which is an inland agricultural, primarily Latino community that's not going to have the same kind of storm rise and hurricane storm flooding exposures as Miami Beach, but has very different context. So it's very important to think about the locality, and how environmental exposures play out. Secondly, are vulnerabilities, and that's exactly why Homestead is different from Miami Beach. Vulnerabilities will tend to manifest in similar patterns in the United States. And by that, I'm talking about racism and income disparity, but they've evolved very differently at the vernacular level, at the very local level. So let me talk a little bit about that, how some vulnerabilities are universal. Classism and racism are playing out throughout the United States in different ways. The measures that we include in many of our studies are measures of race and measures of race and ethnicity and measures of income. But the reality is being a certain race is not a vulnerability. It's the treatment that you receive because of that race. So it's racism and classism that are their vulnerabilities. So it's important to document the numbers, but also then think about how that manifests in different disparate treatments for these communities. Same plays out for classes, right? The difference in what income and intergenerational wealth can afford. And we all know that the national pattern of the number of people who can afford, for example, enough money to cover a $400 emergency expense. I believe that the last measurement of this from the Federal Reserve just this past year was that 37% of American households lack enough money to cover $400 worth of emergency expenses. So there are national patterns, but again, it is so important to see how these vulnerabilities and the exposures translate locally. And the 6 cases frame that pretty well. So the second point I want to make is on one specific manifestation of that vulnerability, and that's my world of housing. The paper considers pre-existing conditions as sort of the vulnerabilities, and they're broken up into those 2: economic, health, and infrastructure conditions. One, I'm very grateful that you call housing quality and infrastructure. I certainly believe that, and many of the people in the housing advocacy world and other people who practice on the housing development and maintenance side. I certainly believe that it's a fundamental component of our physical infrastructure in this country. But let me expand a little bit about that as an indicator and what the underlying inequity is that has led to further disparities. We know from the State of the Nation Housing, which the Joint Center for Housing Studies produces, that about 40.6 million households were cost burdened in 2021. Now, cost burden just means that 30% of your income is going just to your housing costs. That 40.6% includes 20.3, about half of that burdened household, those burdened households are severely burdened. That means they're paying over 50%, over half of their income is going just to their housing costs. So it's either the rent, mortgage, including utilities, et cetera. 50% of several people's incomes. Certainly for renters, that plays out much more distinctively. Cost burden renters are at a record high. It's about 21.6 million households in this country, with 11.6 million being severely cost burdened. So it's easy to note, housing is just unaffordable in this country, in most parts of this country, including in rural communities. There are very few places in this country where making minimum wage allows you to afford just the average rental cost in this country. So in that pot of housing costs are your housing upkeep. Our homes are getting older in this country. The average age of that US home, the actual house, is 43 years of age. And that's been up from about 27 years just in 1991. So our homes are getting older, which means it takes more money to upkeep, to keep them up, to maintain them, to remodel them, to keep them at any sort of basic level of performance. And when they don't, you can't afford to upkeep them, you go into disrepair. About 5% of all U.S. housing is moderately or severely inadequate. That's according to the American Housing Surveys. This is about 7 million households in the country. About 3 million of those are homeowner households, and 4 million are renter households that live in these moderately or severely inadequate housing. I should note that the number of renter households, so these are renters living in homes that have some kind of structural deficiency that are inadequate in any way, increased in the last 2 years by about 350,000. So that number is going up. But one thing I want to make sure that we're very clear about is when we're talking about housing quality, and these measures of adequacy and disrepair, we need to speak a little bit more about the inequities by race and income. So all of these measures that I've been talking about have disparities by race and income. But there are also these overlying questions about what do we consider to be adequate housing in this country. We measure quality and approach inadequacy from very specific ways, that is as basic habitability. So one, the estimates are basic adequacy are already likely underreported. But two, the bar is pretty low to call something adequate. Adequacy in my mind should not just be about basic habitability and shelter. Adequate housing should also be about energy efficiency and resistance to hazards and improved health performance and health conditions for the occupants of the homes. But just looking at this year's heat wave, we have to think about housing that reduces the cost of your energy bills while keeping the interiors of our homes cool and air conditioned so that people don't suffer. Just thinking about last week's fires in Hawaii, we have to think about adequate housing or definitions of adequacy that make housing that is better for our neighborhoods and better for our country and better for our planet, beyond simply the basic sheltering characteristics of housing. And so the wealthiest nation in this country, in my mind, should strive for a much higher performance than just basic adequacy. Okay, so my second point was on housing. The third is going to be on the recommendations and findings of the report. The study is a really helpful preliminary survey into these 6 communities, right? And showed that the power of place-based analysis is a really helpful way of thinking about how exposures or vulnerabilities play out. Pushing that a little bit more and thinking about what the nature of the prescriptive recommendations for those specific places would be, I think is our next challenge. There are some national programs that are identified in the report, certainly pushing those, expanding those, appropriating enough resources to those is an important piece of the equation. But we have to think about some of the other characteristics that are playing out locally and what can be done in those specific communities to help improve the situation of those residents. A lot of these are self-determination opportunities. The study, I'm very happy noted the idea of community strengths and adaptive capacity of some of these communities. We may want to push that a little bit and think about what it is that is necessary to improve the capacity of those communities. And what are the resources and skills needed of local organizers and local organizations? What is the representativeness of those groups within their community compared to community sentiment? And how do we harness some of these opportunities to have local suggestions, have grassroots suggestions about how to improve the situations? But more importantly, it's the broader policy considerations that I think we can push. I'm a big believer in naming names and documenting culprits. So when we talk about some of the disparities and vulnerabilities in these places, we can talk about the local, which specific politicians, which specific utilities, which specific institutions are involved in ensuring that those disparities are perpetuated. And that way, savvy advocacy groups and political campaigns and any philanthropic funders that may be out there listening on this should be investing in those specific campaigns and in addressing those specific institutional barriers. Right. So, and one of those, of course, is housing policy. Means we have to have specific policies in those places that demonstrate some familiarity with who the local practices and practitioners and politics of housing are. We have to produce more housing, that's for sure, in every part of this country, and make sure that a significant portion of that growth in housing is provided to on an unaffordable basis. Excuse me, I was about to say unaffordable, on an affordable basis. So that'll be it. I'll pass it off to my colleague commentator, and I'm looking forward to the questions.
Wonderful. Well, thank you so much. Glad to be able to join you today to talk about this really fantastic report. I want to start by acknowledging the framework in the report and crediting the report for discussing pre-existing conditions that put frontline communities at greater risk, being economic, health, infrastructure conditions. We know that our communities have a powerful effect on our health and well-being. And when we talk about inequitable health outcomes in the United States, we need to talk not only about access, quality, and equity of our healthcare system, but also about living conditions like education, economic stability, housing, climate, pollution, neighborhood conditions, because these are all what we refer to as social determinants of health that play a larger role in shaping our health than the healthcare system. And again, as the report points out, health is so intricately connected to economic opportunity. It's tied to your ability to afford healthcare, your housing security, your distance from a toxic chemical site. So all these things are critically important to our health. And we know that people with the shortest life expectancy tend to have the most poverty, food insecurity, lack of access to healthcare. So if we want to improve the health of Americans, we need to target all these drivers of health and historic inequities. We can go to the next slide. Thank you. So as we know, and the report points out, extreme weather is a serious and growing health and economic threat, with the most severe consequences for people living in low-income communities, as well as Black, Latino, Indigenous, and other people of color who have experienced environmental racism. And we know that neighborhoods that have minimal tree cover and lack of green spaces, that have fewer energy efficient buildings and homes and high rates of energy poverty experience greater economic and public health consequences that are getting worse with extreme weather. In terms of the health consequences of extreme weather, we know that high temperatures and wildfire smoke heighten cardiac and respiratory risks. We know that as temperatures increase and growing seasons get longer, there's more allergens in the air. There's also an expansion of the range of mosquito-borne illnesses that thrive under hotter and more humid weather conditions, and also foodborne illnesses that spread more with higher temperatures. And then last, we know that weather-related emergencies cause profound stress that impacts our mental health. Climate events also affect health by impacting the healthcare system. So just to mention here, a recent report that Center for American Progress just put out, which showed that there was an increase of almost 235,000 emergency department visits and more than 56,000 hospital admissions during heat event days each summer, and that costs about $1 billion. So I am going to talk a bit about extreme heat because it has been so front and center over the summer. So next slide, please. So among the many recommendations, some of which are contained in the examples in the report, things like community cooling centers and shifting to clean energy we'll get to, but just to say that we need to focus in a couple of places or a few places. One being tracking climatic conditions and identifying vulnerable places and populations. The next being reducing greenhouse gases, and that includes in the healthcare system. And then third, improving community infrastructure and resiliency. So I will talk about those things as we go forward. So next slide, please. So I want to share some examples of policies that can mitigate the health impact of extreme heat. So there's a few here. So for instance, requiring that the state adopt or develop a heat action plan or early warning system. So New York is an example here. States can also require actions and outcomes that are required as well as the plan. The next would be protecting workers. So things like shade or water breaks for people that work outdoors. An example being in Nevada, where the Senate passed a bill that requires hourly 10-minute breaks for outdoor laborers. The next being improving public outreach and awareness and response capacity, and providing resources to communities, particularly those that have been historically disadvantaged and suffer from significant heat disparities based on race or income. So California in 2021 passed a climate resilience package that included funding for urban greening and low-income weatherization, the low-income weatherization program, and also community resilience centers. And then in 2022, they added an extreme heat package that provides support for employer and worker outreach, also outreach to long-term care and childcare facilities, and outreach to farm workers. The next example is mandating studies to identify urban disadvantaged communities that have concentrations of heat islands, and recommendations for how to address the adverse impact of those heat islands. So an example there is in New York. The next example is ensuring that power and water remain connected during National Weather Service heat warning. So in Washington, for example, there was a bill to ensure that utility operators can't shut off power or water during National Weather Service issues, when the National Weather Service issues a heat-related warning or alert. And then the last example here is the U.S. Department of Labor, which plans to issue a hazard alert for dangerous conditions in industries like agriculture and construction, where workers face a greater risk of injury and death from extreme heat. And also the Department of Labor plans to boost inspections for those sectors. There's other examples like establishing a heat officer or construction with reflective roofs. And then there's a number of other kinds of examples that aren't necessarily extreme heat related, but for instance, wildfire protection, or ways to improve air quality in schools and workplaces. And so some of that could look like requirements for air sampling to determine risk, or providing guidance on portable air cleaners, or informing the public about the risk of poor air quality related to wildfires and how to protect themselves. There's also examples of policies in cities. For instance, Phoenix, Arizona is planning to rent hotel rooms for people who are homeless, or Austin, Texas is sending cooling buses into neighborhoods to help people with extreme heat. Next slide, please. So there's some great examples in the report. For instance, like the East End Bridgeport faith-based community approach to creating cooling and warming stations. I wanted to share another example, which is in our report on extreme heat, and it focused on Richmond, Virginia. So in the summer of 2017, residents in Richmond joined a community effort to measure daily temperatures by neighborhood, and they found at the hottest time of day, there was a 16-degree difference between the coolest and the warmest neighborhoods, with lower income communities and communities of color disproportionately exposed to heat extremes. And not surprisingly, it maps very well to communities that had previously been redlined. So city leaders developed a master plan to reduce urban heat with a priority for areas that have high heat vulnerability on a high heat vulnerability index rating. So city leaders used the heat index. They identified heat islands, prioritized affected neighborhoods, and then they worked on interventions like lighter colored roads and roof surfaces, and varying building heights so that they could encourage air circulation, tax and zoning policies that limit parking lots, and ways to increase tree canopy and green space. The city also has an equity-oriented sustainability plan that calls for cooling relief and utility bill assistance. And they have a forest master plan and adopt a tree program. They're also mandating benches and shade at bus stops. And some of the interventions are being led by local government, and some are being led by community organizations. An example would be volunteers have helped plant more than 60 trees in low-income neighborhoods, and a museum in the city converted some of their parking lots into public green space. Next slide, please. So what I've been talking about so far are ways to impact health by addressing social determinants, but now to talk a little bit about the healthcare system, because as the report points out, limited access to healthcare, risk of preterm births, and higher rates of chronic health conditions create additional challenges for communities dealing with climate change threats. So we need to make sure we're taking care of people today, and that we're preparing our health system to be better able to respond and withstand extreme weather. And we need to make sure that the healthcare system reduces emissions that are contributing to the problem. So the reason to shift the healthcare system to clean energy is because our medical care is causing environmental harm through purchase of supplies or energy generation, waste, even healthcare transportation. And there are things that the healthcare sector can do. So one simple example would be switching anesthetic gases to cleaner options, which actually can cut emissions and also save money. So it's really important that we look at ways for the healthcare system to switch to renewable energy. And that not only reduces carbon emissions, but it also improves the resiliency of the healthcare system, because if the power goes out, it's able to function. There's other things the healthcare sector can be doing. So training physicians and first responders about how to diagnose and treat people who are experiencing extreme heat. And there are examples, for instance, in Miami-Dade County, there's a heat task force that's working with clinicians to prepare them and develop materials that they can distribute to patients. There's also ways that health systems can be screening for people who have a vulnerability to heat, the same way that providers screen for food insecurity or housing insecurity. Health plans can also tap into new ways of paying for care. So an example here would be in Oregon, where networks of providers that serve state Medicaid beneficiaries can offer new kinds of services that maybe aren't being offered in other states. So, for example, providers in Oregon can offer air conditioning units, or they can help patients with electricity costs as part of the Medicaid program, because they know that that reduces health risks and creates better health and saves money for the health system. And then the last thing I want to mention is that nonprofit hospitals can be held accountable for their obligation to invest in community benefit. So because nonprofit hospitals are tax exempt, they are required by law to improve the communities that they serve. And there are a number of ways that hospitals can do that. They should be doing that in conjunction with an assessment of community needs. And for instance, things that they can do are help to improve housing stock, help to build up housing supply. They can be working on ways to make sure that homes are climate resilient, things like flood proofing or removing toxins from homes. So that's another way that the healthcare system can help improve health and prepare for climate health risks. Next slide, please. The Office of Climate Change and Health Equity, which was established by the Biden administration within the Department of Health and Human Services, is there to address climate change, and it has an Office of Environmental Justice within it. And that office is working on things like identifying communities that have disproportionate exposure, addressing health disparities, looking at ways to reduce greenhouse gases in the healthcare system, providing training opportunities for clinicians. So these are all things that the office is setting up now so that it can address the health risks of climate change. Next slide, please. So the Bipartisan Infrastructure Law and the Inflation Reduction Act are investing more than $50 billion in climate resilience and adaptation. And this is coming to states and communities through grants and other kinds of mechanisms. And just to point out a couple opportunities are the Urban Heat Mapping Campaign, or Heat Island Mapping Campaign will fund communities to map urban heat and use the maps to take action to reduce the risk of heat illness. The Environmental and Climate Justice Block Grant Program will provide funding and technical assistance to reduce pollution and climate threats in underserved and overburdened communities. So there are a number of opportunities. The Center for American Progress has an investment tracker, which is a searchable database that you can go onto and look at communities that are benefiting from these investments and see the kinds of opportunities that they're taking advantage of. There's also efforts happening through FEMA to shift away from reactive disaster spending towards proactive investment and community resilience. And there's funding through the Inflation Reduction Act that can help the healthcare system do the kinds of things that I mentioned earlier through direct funding and also through tax incentive opportunities that health systems can take advantage of to improve their climate resiliency and reduce greenhouse gas emissions. Next slide, please. So along with the funding, these federal investments, many of them are targeted to communities that are overburdened by environmental pollution and climate change. So President Biden's Justice 40 initiative was developed to make sure that 40% of the overall benefits of climate and clean energy investments are going to disadvantaged communities. There's a number of examples here of the kinds of programs that are covered by Justice 40, and those programs are looking to make sure that the investments they're making are meeting that requirement. I just want to wrap up by applauding Just Solutions for this great report. I hope the information's been helpful to look for ways to mitigate the health impacts of climate change, and we'll look forward to conversation. So thank you very much.
Amazing. Thank you to all of our presenters for those wonderful presentations. We are now going to move on to the Q&A portion. So as I mentioned, if you have any questions, please feel free to use the Q&A box or even the chat to drop your questions. And yeah, we'll get started answering some. So we did get some questions coming in. So this question is for either you, Jill, or Carlos. Are any heat interventions connecting putting in heat pumps into housing to provide for cooling, ending reliance on fossil fuels? So they're asking, have you heard of anything similar in that area?
So there's one of the technologies that you can get a rebate for in the Inflation Reduction Act, as well as it's increasingly available in the Weatherization Assistance Program. That was one of from the Infrastructure Investment and Jobs Act. So a lot of municipal and utility programs will also incentivize that kind of electrification of air conditioning systems, as well as water heating with heat pumps, rather than gas or any kind of other fossil fuel based technology. So the states that are preparing their rebate plans right now, their IRA rebate plans right now. So I would encourage everybody who, if you're looking for specific information about what your state is going to offer, those rebates should be offered for heat pumps in your communities. So just look for them. And remember, if you make less than 80% of area median income, you're entitled to double the rebate for those technologies. In most cases, that'll cover the majority of the costs of heat pumps.
Amazing. Thank you for that. And then another question was for either you, Zulie, or Jennifer. How did this study view mitigation of industrial pollution and greenhouse gas reduction as a root cause that continues to exacerbate resilience?
I can tackle that and Zulie jump in. I think that's kind of at the heart of Just Solutions work. So I think, you know, our colleagues are working on those issues in depth from a policy perspective, and we do a lot of research on that work. The intent with our report was to identify the specific challenges that communities face daily in coping and adapting to climate change impacts that currently exist, and that are only going to grow worse in the future without greenhouse gas reduction and climate action. So, I'd say, you know, absolutely, that's a focus of the work. But yeah.
Awesome, thank you. And then this question is for you, Jill. How do you get states that are not politically aligned with climate policies to take actions like the ones you recommended in states like New York, California, Washington, and Nevada?
Great, thank you. That's a great question. And I think there's a couple of strategies. I mean, one is to talk about the health threats, because I think, you know, as we now know, you can see them, you just have to open the window in many places. So whether it's, or feel them, if it's extreme heat or if it's wildfires, they're, you know, quite pervasive. And so I think, you know, first of all, I think everybody sees them. Policymakers see the threats now. I think emphasizing costs can help. So for instance, in the report we just put out that showed $1 billion in costs from emergency department visits and hospital admissions from extreme heat. That's attention getting to show the costs that of these climate threats. And then I think the other thing is to emphasize the creation of good jobs. So the Inflation Reduction Act has triggered investments in pretty much every state. And, you know, the investments are in things like renewable energy, electric vehicles, and there's an emphasis on creating good jobs, good, clean jobs and unionized jobs. And the investments right now are disproportionately landing in Republican-led communities. So I was just looking at some numbers around this that about 60% of the investments have been going to GOP-held districts. And so, you know, I think that this is something that everybody can benefit from. So the creation of jobs, whether it's in solar energy or new battery factories, is another way to kind of sell the investment that is good for people, because again, jobs create health, and they also reduce the emissions and other factors that are threatening our health.
If I could just add to this, I certainly appreciate the comments, the arguments regarding employment and health and financial well-being and outcomes that could come out of this. The reality is everybody who's on this call has to get political, and you have to make sure that you're voting for and organizing for politicians who are going to be supporting your households accessing these resources. Because we've been talking about the jobs, about the health outcomes, and the financial benefits for the last 20 years.
Thank you both. And then we had another audience question. They say, here in Philadelphia, we recently launched a forgivable loan program for small landlords to complete repairs in exchange for rent affordability. The program is popular, but it's tricky to incentivize landlords to incorporate energy efficiency upgrades. Are there states or cities that are effectively pushing private sector landlords to electrify or add cooling to their properties? And this is for anyone who knows the answer.
Yeah, some states are investing a lot more in their multifamily property redevelopment. It's better to say there are more local programs that have been more effective in this. If anybody on the call is from Elevate Energy, I'd invite them to start speaking, because Elevate Energy in Chicago has probably been the biggest warrior in that multifamily battle for about 30 years. With the weatherization assistance program, expanded funding, and the rebate program. And remember, the rebate isn't, you can be a renter in a multifamily household and have your building eligible for these programs. The states are going to have to come up with plans to do really good landlord outreach. What the weatherization program had been pretty weak with landlords, except in certain places like New York, like you may be surprised, Minnesota and Wisconsin. But there has to be more of a concerted effort by the state program officers to make sure that they're doing good recruitment of those landlords. Because at the end of the day, the landlords will have rent increase restrictions. But they will benefit from having better equipment in their buildings, even if they're not paying from the utility. So making sure that sales pitch is done well is an important piece of this.
Awesome. Thank you for that. It's very helpful. And then Jill, another question for you. You mentioned opportunities in improving health systems by investing in communities. How can investment in climate preparedness with a public health lens potentially improve healthcare access and the healthcare system?
Well, I think in a number of ways. I think investing in climate resilient healthcare systems, and also investing in climate resilient communities, that then reduces the burden on the healthcare system. So, we know that the severe weather events, which really generally are the result of climate change, put patients and providers at increasing risk of disruption of services. And so that can interfere with healthcare. And I think actually this was even brought up earlier, just by disrupting power or water supplies. Excuse me. So that would then prevent the ability to get medical care to people, and it can affect evacuation. And so I think that, investing in making the healthcare system more resilient, as I talked about earlier, and also just these efforts to make the community more climate resilient, will then make sure that the healthcare system is less burdened and more available when people need it.
Wonderful. Thank you. And then another question, how can local organizers or advocates use this research that we've been discussing today to advance community power building and change policies? So that question can be for anyone.
Can you
I-
repeat the question?
Yes, definitely. How can local organizers or advocates use this research to advance community power building and change policies?
I mean, one thing I would say is that I think, having the data is really important. So I really like the example from Richmond, Virginia, because they worked as a community to do that kind of study to show disproportionate impact. And I think that then, that can be used to kind of make the case for investments. And again, I think with the Justice 40 initiative, there is an intentional effort to make sure that the funding is getting to communities that are disproportionately impacted. And again, that's a data thing. So having that data to be able to show disproportionate impact, I think, is really important. And then I think, kind of using the examples that we see in the report and some of what I've shared from Richmond in terms of, there are things that we can do, like changing the way we construct roofs, or converting pavement into green space, or having shelter at bus stops. So I think, using those examples is a useful way to think as a community about ways to encourage change that can support health.
Awesome, thank you. Go ahead.
So all of these things cost money and require political will. So you have to start naming names, start telling the stories of the community, calling the press, start finding local elected officials who are willing to support an investment of resources in your communities.
Definitely. Thank you for that. And then speaking of data, a couple of questions for the authors of the report. Jennifer, can you share how the indicators were chosen for the Perfect Storm report?
Yeah, so we wanted to look at indicators that showed the intersection of economic health and infrastructure in a way that reinforced each other and that spanned both current efforts to cope with climate change and future climate impacts. So for health, we focused on, as we talked about, chronic conditions whose treatment relies upon a steady supply of power. And during shutoffs or blackouts, these conditions become life-threatening. We also included healthcare access, since poor, as we talked about, poor healthcare access now makes chronic conditions worse, but in a climate disaster, healthcare access is also part of emergency response. In regard to preterm births, preterm babies face higher risks of lung conditions like asthma, which are worsened by climate change. But at the same time, pregnant women who are exposed to extreme heat have a higher risk of having preterm babies. In regard to infrastructure, we looked at household housing quality as both an indicator of net worth, but also the threats to health that come with flooding events, for example, and outdated septic systems and water systems and industrial exposures the same way present enormous problems, especially with flooding. So we wanted to focus on those areas where we could show that intersection.
Awesome, thank you. Well, thank you everyone for all of your great insights, your presentations. They were so informative and helpful. And we are approaching the end of our time. You did a great job on timing. It was really wonderful. And I am going to, in the chat, link our post-event survey. So feel free to fill that out. Let us know what you thought about today's event and ways that we can continue to be helpful and put out research and content that's helpful to the work that you're doing. We also hope that you can join us for part 3 of this series, where we will be talking about some community-created solutions. We also will be having a podcast coming out about the Perfect Storm report, so stay tuned for that. And I also will be sharing some follow-up materials in an email later this week. But again, if you have any questions for us, please feel free to reach out. And thank you again to our presenters for spending this hour with us and sharing your insights. And with that, I hope you all have a great rest of your day. Thank you.